कर दिया.
मोबाइल बाहर पॉकेट में ले ले तो. अच्छा.
Both the colors are same, two colors.
Okay.
बैटरी का सेटिंग्स देख लो.
So
आप इधर आ जाओ उधर.
You stay.
Yeah, you can stay now. I'll give you a scenario and then you can start
yes sir.
thinking, isn't it?
1800 RPM.
So this is the same child who has been put on ECMO for 2 days back. Yesterday he had an episode of desaturation, tachycardia. With the same RPM, the flow decreased and P1 pressure become more negative. And they found out that there was a venous tube which was kinked. Patient had a tachycardia followed by bradycardia also. We had a bradycardia. But luckily things were diagnosed time, so he didn't have a cardiac arrest and recovered well. Okay. So today is day 8 of ECMO. Child is becoming conscious, awake. Physiotherapy was came and given a physiotherapy, and this child is otherwise doing well. Okay. It's now over to you. I was in the night duty. Now I've finished my duty, so you are there on duty to manage these patients. You can ask me if you want any information, otherwise we'll go and rest.
So sir, we will be dividing into team. Out of us, 3 will be taking care of the patient and the cannula.
Allocate the role. So
You're asking any details you want.
So sir, at the ECMO day is day 8, and yesterday he was having hypovolemia and kinking of the tube. And what was the flows before that in before physiotherapy?
flows is around 2 liters.
2 liters. So on
It is almost same.
same flows,
Yeah.
no change in the flows.
Yes.
Vitals are okay. What is the ACT, last ACT, sir?
Last it is around 170.
And inotropic support, sir?
Inotropic support, no, he doesn't require an inotropic support. He's not on any inotropic.
Fluid status, sir?
ABG, pH is around 7.41, PO2 is around 68, PCO2 is around 34, and bicarb is around 24.
Lactate?
Lactate 1.6.
Sir, is there any imaging done recently?
No, the last X-ray which I showed you was that was the last X-ray.
Sir, fluid status?
Not has been repeated.
Fluid status, sir? Urine output
Output is okay. Is euvolemic.
is negative or positive?
Is euvolemic.
Euvolemia. Okay.
Physiotherapy started since how many days, sir?
Physiotherapy started since last 3 days.
3 days. Okay. So patient mobilized out of bed or on bed physiotherapy only?
No, it's on bed physiotherapy.
On
only.
bed physiotherapy.
Yes.
Okay.
Heart attack.
No, they have just given a
And what time
bedside
physiotherapy
position that's just taken on a wheelchair. That's it.
Okay. At what time, sir? What time means before?
That was done yesterday evening.
Yesterday.
Was there any adverse event during that time?
No, there was no adverse event during that time.
So, we'll divide it.
We will divide the team. So out of you people will be on the console.
Console and circuit they are taking
And
care.
from this side, two will be on the ventilator, and we will monitor the patient and the lines.
Yeah, check.
And you will read.
Pulses
Yeah.
are good.
First, we'll explain to the child that we are going to do
Physiotherapy
mobilization.
has already been given.
So any sedation,
Physiotherapy
sir?
has already been
He's
given.
under
No,
sedation.
as in
Yeah.
Under sedation.
even before today.
Patient is desaturating. His saturation has come down from 91.
So we
Change
can
the
see the change in
tube.
the color of the tubings.
Change the color of
Color
the tube.
so there may be displacement of the tube during physiotherapy.
Both
so
the
is
tube
there-
are same color.
They
and
both are in
this
the
is
same
dark,
color.
So maybe pump failure,
I think there
oxygen
is,
failure should be.
Pre and post, see?
See the pressure.
Child is desaturating.
So
Pre and
we'll
post.
increase the
ventilator.
ventilator settings.
First check the tube whether tube is in.
No, ventilator settings was.
Everything is okay.
No.
hypoxia is there.
Oscar did.
No, 100.
How are the
Tube is in place.
Check
tube
for
is
the
in place.
oxygenator and the
And
pump.
The
please
pressure is
please check for
okay.
the flow.
Pressures are okay, and increase the sweep gas.
So increase the sweep
Flow
gas.
is same.
And the
RPM is
Early
same. What is the
circulation.
pressure? What is the pressure?
Recirculation.
So what is the FiO2 and this sweep gas?
Check the
Sweep gas is 2 liters. FiO2 is 100%.
Sir, I think it's a recirculation
Both will
because
be
the pump pressure is normal.
Cannula side,
There is no
cannula
shattering.
recirculation both
After
will
the
be read.
physiotherapy, I think the
Saturation
cannulate
64.
Let the leader tell. And this is
He is maintaining BP.
this is pump failure. This is all
Maybe
the
they
pressure.
check for the
Flows.
knots.
Sir, all the pressures are looking
Flows,
same.
not the flows.
More or
Only
less
the
normal
oscillator
level.
needs
we can
change.
decrease the flow.
And this
pump
Will
you are
decrease the
Same
rate.
RPM, the flow is more or
Check
less
for the
adequate,
knots
but
in
the flow, no? Then only the
circuit
recirculation.
and oxygenator.
pressures are also same.
I think there is a failure in the oxygenator.
No, एक मिनट
ox-
cannula side देखो ना.
Cannula
So what
side-
is
Is
the,
the pump working?
we take
Yeah,
an
pump is
ABG,
running,
take an
but,
ABG from the post-oxidator.
Oxygenation
Post-oxidator ABG, we need
If
to
it is
How about
recirculation,
what
we
is
have
the
to pull
delta
the
P?
cannulas.
Delta P,
So
everything
we
is
need
fine.
You can see
P
delta
and-
P. You want post-oxidative ABG?
Yes.
Yes, sir.
Yeah, pH is 7.18. PCO2 is around 64. PO2 is around 48.
So
Post-oxidator ABG is less than 200,
So
very less, so it is an
oxygenator is at
oxidator failure.
Oxygenator needs changing.
This is an
Change
oxidator
the
failure.
oxygenator.
Whatever you want, you do it.
We need to change the oxygenator,
So
so
we will
the
change
4
the
people
oxygen.
kindly check.
recirculation नहीं होगा.
No.
So
ये
clamp,
recirculation
6
नहीं
clamps.
है.
No, we have to find the oxygenator.
So we want oxygenator.
We made
Today
6
day is
people,
day 8.
3 teams each, three members each team.
Okay.
So we have increased
We are
the
seeing
sweep
the
gas.
patient, please improve the ventilator settings and
Yeah,
increase
increase
the
it
NORAD.
already.
BP
We are on
is
full
okay,
with ventilator.
We have
but
kept
ready with the
crash
NORAD
card
and ADR and ready with the
crash
cash
card
card. Who is clamping?
So we will clamp. So be ready with the oxygenator. We should prime the oxygenator. Then
First
only
prime the oxygenator.
Oxygenator is ready.
So give them oxygenator. Give them the oxygenator. They want to change oxygenator.
BP is dropping.
BP is
The- the-
dropping.
the-
Just
BP
give
is
some
dropping.
some
Voice
fluid.
volume is
Let's
not
give some
oxygenating.
fluid.
Let's give some fluid.
But it's not functioning.
Oxygenator is not outside.
200 ml
But
bolus.
it's coming, it is
Sweep
going in
gas
the same
increase.
place.
100% FiO2.
How much is delta pressure?
Delta is 35, 34.
Delta pressure is 306.
30.
Same.
Sorry.
Still you want to change oxygenator? Whatever you say, I will give you oxygenator. You change it.
No
Say
oxygenator
patient is
here.
going to bradycardia, start CPR.
No,
Adrenaline.
CPR is just give atropine and
We can
Atropine.
see for the position of the tubing and we can
The position of the
remove
tubing.
Position of the tube.
condition.
Give
Adrenaline,
some-
bicarbonate. Give adrenaline,
they-
bicarbonate.
and give soda bicarb.
Recirculation.
The oxygen.
100
We are
100
giving
soda
bicarb.
bicarb we need.
One thing,
Adrenaline,
the
please.
patient is not getting oxygen.
So oxygen
Basically. So oxygen is whether is connected, whether it is circuit is
What you want?
The flow.
Flow come करना है.
What you want?
Oxygen is
You want
connected.
oxygen cylinder?
Oxygen
Who is
connected.
this
Now
connected?
giving oxygen cylinder. You want to take this in oxygen cylinder?
Yes, sir.
Yeah.
Okay, take him in oxygen cylinder.
cylinder is not working properly.
Decrease the flow.
Decrease the flow.
Recirculation is there.
No recirculation.
Decide one thing. This is first you say sweep gas failure, now says recirculation. Whatever you want to do, you want to decrease the flow, you decrease the flow. Doesn't make a difference. That you have to
We'll have to
decide.
decrease the flow there.
Your post oxygenator PO2 is less, delta pressure is high, 350. It's a oxygenator failure. Just change the
We'll have to decrease the flow.
Yeah. 2 liters.
Is it
2 liters, 100%.
So blender should be at fault maybe.
Huh.
Blender
How
can
to
be at
decrease
the
the
fault because oxygenation is not
One
being
more
done well.
adrenaline.
So
No,
we
I
should
have-
change the blender.
I have connected the
He has already he has taken it on oxygen
With the
cylinder.
Oxygenation, we are changing the blender.
Keep
change
defibrillator,
oxygen,
defibrillator
oxygen,
ready.
100% oxygen connected cylinder.
100% oxygen now. So with the cannula positions also.
No. The pressure is always same. Only the
Then
oxygen is
flow has come down.
You can see whether
oxygen
there
is
is any
not there.
How is
Have to
the flow?
decrease the flow.
Oxygenator.
How to decrease the
Why
flow?
to decrease the flow?
It is a decirculation.
But the same RPM flow has come
recirculation
down
only.
then.
No, he has decreased the flow, I think.
No, RPM is 3800, no?
हाँ.
3000 RPM flow is not improving.
oxygenator कोई change कर रहा है कि नहीं कर रहा है?
No, yeah.
कोई oxygenator दे दीजिए.
I don't know. Yeah. Ventilator scene. No?
No, you connect किया है, 100% किया है. Because there is
I think
no-
it's time for you to just rethink what is your diagnosis and what you are searching for. I can see what brain knows, isn't it?
So it says
So where the tubes
Silent
marked
change
before?
अरे oxygenator change करिए उधर से. Clot है कि नहीं देख लीजिए.
So where the cannulas marked before
Clot-
to the patient?
इसमें oxygenator में clot
Ventilator
होगा.
Cannulas are marked?
लीजिए day 7 day.
No, it's not marked.
Pressure
No,
is
no,
normal. Pressure. Okay. Pressure is normal.
Clot नहीं है, patient normal but failure तो हो ही सकता है ना ज़्यादा.
is there a pump failure?
No.
No, pump is running.
Tubes are
Power failure?
Everything is
not
okay.
there. Oxygenation.
Change oxygen.
ये क्या है?
How is the RPM and flow?
king oxygenator. Oxygenator.
What was the flow before? Before one.
Flow is same.
1.8.
Flow is
He
same.
was maintaining no with that oxygen.
Oxygenator is okay. This is kinking here.
Sir,
Now
what
only
was
it is
the
kinking.
flow before?
The same.
Same.
2 liters flow.
Around 1.8.
When you came, that was
It is 1.8.
no venti zone.
Now the pressure is flow is going low. Same RPM flow is going low.
CPP 624. Flow increase.
No.
If there is clot,
There is no
delta P will
chatting.
increase.
In echo machine
There is
you
no
can have
saturation.
look for hypovolemia.
No, the thing is,
No,
it's
I
not,
still think the oxygenator.
ventilating same color, no?
Is it not oxygenation failure?
There is no, actually there is no oxygenation happening.
So do
In
something.
spite of giving
You,
oxygen.
if you are
So I
sure
give-
about diagnosis, do something.
Oxygenator change.
So
You change
first
to oxygen. Can you do something else?
Change the oxygenator, that is the other thing.
You want to change oxygen with delta pressure normal. You want, I will don't mind.
No, but
Can you think of something, changing something else?
Sweep gas.
sweep gas failure.
Yeah, he's already changed it to oxygen cylinder.
oxygen, directly oxygen.
100% oxygen.
Sweep
No,
gas
it is a oxygen, direct
Pump
oxygen.
failure?
Oxygen cylinder.
No, I would
Then
like
Both the
to
colors will be
reposition the cannula.
circulation, reposition the cannulas. Or we withdraw the cannula little.
Anybody perfectionist from your team?
Yeah.
He is perfectionist. So listen to your perfectionist. He is damn sure about something.
Sir.
something is, oxygenation is not happening.
Oh,
Yeah.
maybe
Can
this
you do
is
something?
is the-
Is there air in the circuit?
Air in the oxygenator?
No, nothing.
No, toward, this is towards
In the pump?
oxygen. Where is
Air
that?
in the
Rightly
pump?
connected?
Rightly, but he was
No, it's not.
on
it was-
ventilator.
In your, suppose same episode happens in your CPB machine, what will you do?
Air vent, open the air vent.
No, it is open.
No, one is connected here.
Okay,
one is connected
fine.
here.
Should we end the scenario here or you want to try more?
We are trying.
Try for 5 minutes.
No.
So any-
Sir, whether
Problem
patient is
gas
going to
failure.
die or he is surviving.
He's died already.
He survived.
He is still on bradycardia, hypotension. He is not arrested.
Pump.
Pump is pumping. Pump is pumping. Oxygenation is not happening. That is the
One
issue.
So
second, yeah.
sweep gas failure we should.
So can you change something else?
Pump
Probably you
change
are on
करो
right
ना.
track.
Yeah, this is fully of water.
Yeah, so what do you want to do?
Condensation.
Yeah, to
Oh,
change
sweep
the
gas,
line.
full the
Give them
sweep
another
gas.
line.
Another line.
Sweep gas failure था ना.
No, you connect it here.
Sweep gas line. Huh?
Yeah.
No, increase the sweep gas, you know.
No, it is
increased.
100%.
So what was there? This is condensed.
Yeah,
आ गया.
change. 100%.
So what is happening? क्या हुआ था बोलो?
Now, how is everything?
Yeah,
No,
tube
okay.
color has changed.
Correct.
Patient is improving, heart rate improving, saturation is
So
improving.
I am shifting back to blunder.
No, both are dark. Both are dark is sweep gas failure. Both are bright
Again
is
it is
recirculation.
come down.
कार
No, blender is the problem.
इसके
then.
अंदर. अच्छा.
Yeah, now it's
Hmm.
Okay. So what was the diagnosis?
there was air, water.
Block in the
Blender and
Yes,
this.
So the one who was diagnosed, let him speak.
Oxygen-
What was your diagnosis?
Oxygen filter got
Condensed.
Oxygen filter got blocked.
blocked with the sept.
Okay, fine. So the diagnosis was sweep gas failure.
Yeah.
Yes.
So it was a telltale sign when the drainage tube and the return tube color is same. Whatever the blood is coming out, same blood is going back. It was a dark red color blood. Okay. It means there is no oxygen taking place. He was consistent in his diagnosis. You people keep on moving around here and there. And he was sure that the diagnosis is oxygenator fail. Okay. Then you have to work out why oxygenation is not, why the oxygenator is not getting oxygen. It was not a problem with the oxygenator. Otherwise the delta pressure would have gone up. The problem was basically with the
Sweep gas.
sweep gas which was not going, and he was right in that. So initially thought of,
Changing the blood.
blender.
yeah, it might be a blender failure, so you change over to oxygen cylinder. That also didn't help. Then he took little time. Usually every time I usually keep the sweep gas, I just disconnect from the blender. But because I was knowing there's a perfume in your side, he will pick it up immediately. So I made it little more spicy, and I just blocked the filter. He picked up very well, but took little time to
Yeah.
pick it up.
You never expect that to
That
get
part
blocked
of circuit we
immediately.
usually
Yeah.
don't take.
Okay, fine. Okay. So now, what are the other causes? Suppose, tell me the causes for sweep gas failure like this.
Blender.
And
One is
blender malfunction.
blender malfunction. Number 2
Sometimes
is sweep gas get disconnected.
disconnected or right.
Number
right.
3,
Membrane edema.
membrane edema will not give us to such a bad scenario. Okay.
The
Number
same
3,
thing we
filter
had
filter can get
again.
blocked. Number 4,
Oxygenator.
Oxygen supply, central oxygen.
Supply maybe get blocked. Somebody got mistakenly disconnected it.
Yeah.
yeah, so that we discussed.
That
Number
happened.
4, probably a rare thing, but then it can happen. And it has, I heard it has happened in one case.
Disconnection from the
Hypoxia.
ventilator side.
No. Why it will work wrong with ECMO? What else? See, once your diagnosis is clear, you are sure that it is sweep gas failure, you have to find out other causes. So suppose now filter was also working well. What can other cause can be there for sweep gas failure? Because you don't want it to repeat, isn't it?
This can get kinked or something.
Yes,
Maybe the
there can be a kink in the oxygen line. Again, same thing, the oxygen supply will be stopped. So again, that it can give us to sweep gas failure,
gas.
isn't it? Fine. Next,
the outlet can get blocked something.
the outlet can be anywhere in the filter or in the tube, which supplies the oxygen.
Low oxygen
There can be
central supply.
Leak,
Oh,
some crack in the oxygen pipeline. Okay. The filter which got blocked, instead of the filter getting blocked, there might be some cut here. So whatever the oxygen which is going, it is leaking out from that side, rather than going inside. Okay.
Okay.
Again, that gives rise to sweep gas failure like picture. But again, in that at least some amount of oxygen will be going. May not be the complete, but there can be a leak from that side. Okay. What else?
Flow meters really.
Yeah, if the flow meter is connected, flow meter is loosely connected, so whatever the air there, it just get wasted. Okay. What else?
somebody might have wrongly connected the oxygen to air, maybe flow meter.
Yes.
That
Okay.
happened.
Wrongly
It
connected.
can happen is
Oxygen to
oxygen is connected to the
air.
central air,
Yeah.
and central air is connected to the oxygen. The blender has got two connections.
Yeah, opposite.
Okay. So the connection is reverse. Okay.
But they are
Some
customized.
safety margins.
same.
Yes, yes. I have an answer to that. I'll tell you. Okay. This will go to the oxygen plug. This will go to the
Air.
air. Now both has got a different connection. So different pin. So oxygen will not go to air will not go to oxygen. What if this pin is changed?
They have a
What
round
if
pin.
this pin is been changed? So when at the time of changing this pin,
Yeah.
somebody puts air pin here and somebody puts oxygen pin here. So it will go and fit inside. Okay. In this way it won't go. But suppose I put a oxygen air pin in this pipeline and oxygen pin in this pipeline, it will go. So you connected this. Okay. So what will happen? Now what will happen?
So
Still oxygen is going.
Yeah,
Still air is
21%.
going.
But it is
So
ulta.
why sweep
It
gas?
is ulta going.
Yes. So when you keep 100% FiO2,
there will
actually FiO2 is going 21%,
21%.
because only air is going. When you do reverse, when you decrease the FiO2 to 21%,
be sweep gas.
No,
100% oxygen will
oxygen
go.
will go.
Okay. And that is the way you diagnose case. There can be and that is what similar thing had happened in one of the case where they diagnosed that the moment they used to make 21%, the tube color used to change and the saturation used to improve. Make it 100%, saturation used to go. So that's why they realized that there's a reverse connection. So okay. So all these things can happen. So sweep gas failure is not only disconnection and blender failure. There can be many more things. So what I mean to say is when you have telltale sign, this is a telltale sign that both the colors are same. It means something wrong. So you have to always think in terms of there's something wrong with the sweep gas failure. Okay. Last thing I would have thought of oxidator changes, because even if you change the oxidator, what would happen?
It won't
The
change.
same thing.
Isn't it? So always think more logically rather than just jumping into the.
We had to check
Excellent.
every connection from the oxygenator.
Okay. Fine. So that's about the entire scenario. Okay. Now, retrospectively, what do you think? Where you went wrong and how you can improvise things? when if you have to do the same thing again, how will you do a better way?
Our perfusionist is confident about being oxygenation failure. So we might have checked from from where we are getting oxygen
Yes.
till
Check from the source till end. If you do that, probably you'll get the answers, isn't it? Yes.
We never thought of the filter now.
so every time we need to consider, and we should keep in mind something new may have happened.
Anything can happen,
Yeah.
isn't it? So, it might be rare, but might happen with you only. You never know. When it is described, it means it has happened sometime. It's that simple as that, isn't
So
it?
always complete circuit check is an important point to find out.
Fine. So, what good thing you done is, you came mentally prepared to face. Immediately you divided yourself and everybody started looking into, okay, there might be something, we'll pick up fast. So that your enthusiasm and your entry I was quite happy. But then there's no coordination between the team. See, it's not important that only the team is get divided, the team has to be coordinated. One person was thinking something, one person was thinking something, third person was thinking something, everybody was putting their ideas. You could have easily said that, yes, I told you also, just relax and rethink. When you are stuck, something like that, speak to the person, discuss with each other. You never discussed with each other. Everybody was like managing alone, independently. So it has to be, so he was consistently saying that, yes, there's something wrong with the oxygen pipeline. You should have spoken to him, yes, why you feel that. He could have given his logic, and then somebody would have come out with, yes, this can be the problem, isn't it? So always, it's teamwork does not mean that you divide the work, that's it. That is not a teamwork. Teamwork is everybody works together. So you allot the role to look into, but everybody works together. There has to be a team leader, and for that you require a team leader, so that everybody works together. Okay, so that is what is very important. Okay, suppose you are stuck. You have seen child is going with bradycardia, you are stuck badly. I didn't see any time discussion among yourself. Okay, what can be wrong? Okay.
We were discussing with, I was discussing with sir actually. So I was also considering it
But
could be
that was
oxygenation
very last
related.
when I said, okay, when your perfusionist is saying something, listen to the perfusionist. Okay, and that is very important. It comes to, when it comes to the mechanical problems and technical problems, you should listen to your staff, because they might be giving you more valuable information than what you know, because they are sitting with this patient for a number of hours, 8 hours. You might be there for few minutes. Okay, so they might give you valuable information. So always listen to that. So and that is what the role of team leader is. He has to listen to everybody and then come to final conclusions. Okay, overall well done. He diagnosed it. It was a difficult scenario, I agree. Usually I don't keep such a space, but then I said there is a perfusionist. He would have just picked up in a few seconds only, and then I could not have able to discuss all this. And probably you learn and we have an habit of learning in the hard way. So the hard way, let it be in simulation rather than with the patient, isn't it?
Yes.
That is always a better way to learn. Okay, fine. Anything, Kapil or Vishal, or any questions from audience downstairs?
Yeah, I have a question, sir. Here.
Yeah.
What if careless recirculation happens?
Both are bright red.
They
right?
will be red.
Bright red.
Bright
Yeah,
red.
they
Both
will
will be
be
bright red.
Recirculation both.
Good afternoon, sir. I
Yeah.
would like to ask that before the simulation started, the tidal volume which was being delivered on the ventilator screen, it was a normal plateau curve what we see usually, the the pattern. And after the desaturation, the peak pressures were intermittently high, around going up to 45, 51, and the tidal volume, the flow was not good on the screen. So could have been the tube related complications, because the patient had
I
just undergone
ausculted already.
physiotherapy.
I ausculted already.
There are two answers to this. One is the clinical answer is if it would have been a tube related issues, okay, ECMO color change would not have occurred. Both the colors would not have become the same. So definitely when both the colors were same, it was something wrong with the ECMO, not with the ventilator. Coming to your second part of the answer, why the peak pressure and everything is started, because she started giving cardiac massage. So that has disturbed the lungs and that has increased the tidal volumes. So that was the reason for the volumes and peak pressures going high.
So the big thing
Sir,
was
another one intervention which I wanted, they should have increased the rest ventilation to.
Yes.
So we have already done that.
Yes. So I'm repeating.
FiO2 was increased, but the tidal volume and PEEPs were not increased.
Yes.
I think they should have
told
gone up.
actually, but maybe knobs were not.
No, we have
We started
considered
with the
it as a
increasing
mechanical issue.
We went
Increasing the ventilatory settings,
So-
initially we told that.
No,
Yes, see, whenever there's something wrong with an ECMO, definitely you have to go up on the ventilator. Okay, because otherwise, how the child is going to get oxygenated or ventilated, isn't it? So that is very important. Fine. So always, any mechanical issues, always go on up on the ventilator, and any issues patient related, go up on the ECMO. So that's the thing which you should always remember. You could have done this because they missed it. See why she picked up immediately, because they missed it initially and then they have done it. So now you should have probably, after seeing them, you should have done better, isn't it?
we have increased, but we have increased
have
only
increased
FiO2.
Yeah, only. So increasing only FiO2 will not.
Tidal
You
volume
have to
and
get it to moderate ventilator settings, increase tidal volume, increase respiratory rate, everything. Okay, that's an emergency ventilator settings. Okay, fine.
Sir, before they arrived at the scenario, before they get the complication, they were dividing the team. So ultimately, they were expecting that something is going to be wrong.
Yeah, they were prepared. They were prepared and came. So I had to make it a bit spicy.
Yes.
I could sense that they are prepared and came, so I had to make it a bit spicy.
And we are lucky that we have a perfusionist in our team.
Maybe that is the reason we got a complicated case.
No, this is the way you learn, isn't it? This is the hard way of learning, but that's the probably in simulus is the best way to learn, isn't it? Otherwise, this is not written in any book.
No, sir. It's a learning experience for everyone, sir.
Yeah, it's a not only for you, the
everyone,
people are
yes.
sitting downstairs also.
Definitely.
Any other questions?
No, sir.
No. Okay, fine. So thank you. Well done. Before you leave, one thing you learn from this scenario, one by one. I don't want you to repeat. We'll start from here or here.
Unexpected things should be expected.
Yeah. Any unexpected thing happens, so you cannot just relax. Okay. Yes.
Yes, sir. Because we never expected that that filter will get clogged.
Yeah. So filter can get clogged
We
or
used to change the lines and all these
Yes.
things, but I never look at these things.
fine. Listen to your team members. That is very important. Yes.
Listen to the technical team also.
No, no,
sometimes.
no. I don't want to repeat. I say something else. Many things we discussed.
Yeah.
Sweep gas and all, check the properly.
Yes. If there's something wrong with sweep gas you are expecting, check it from the source till the time to the delivery point. Okay, check everything. Fine.
The team coordination was lacking in this.
Yeah?
Team coordination was lacking in this.
Yeah, team coordination is very important. Just making and dividing the role is not important. Team coordination. You could have asked me, sir, let us discuss in 2 minutes and we'll come back to you. That could have been done, isn't it? Yes.
Sir, I think, never miss a pathognomonic sign or telltale sign in any patient. Like
Yes.
it was, you have told repeatedly that both bright recirculation, both dark is sweep gas failure.
Yes.
Sometimes it came out from my mouth that is oxygenation failure also, or oxygenator failure I thought. So that was the thing.
Yeah.
So never
So
miss on
telltale
a,
sign is,
yes.
and you have to persist on that. Don't jump, because you find that where you gone wrong is you find it is connected.
Yes.
If I would have disconnected it, he could have just picked up in a less than a minute. But you found that it is connected from here, it is connected from here.
Yeah.
So then you start getting wavering that where is the wrong, and you started thinking of something else. Okay. But when there are telltale signs, don't think of something else. It is going to be the same. Okay.
Once we find a problem, go step by step so that we don't miss anything.
Yeah, go step by step so that you don't miss anything. Okay.
We are struggling with, even we have P1, P2, P3 is in a range, but still we are searching for the oxygenator. That we are lacked.
Okay. So you should be connected, you know, with the things what is going on and what is
Respect
happening.
your monitors.
Yes. Yes.
What
Yes.
the value?
Because because I was on the patient side, I was looking over CPR and inotropes and drugs, but I should have looked over to the ventilator also, whether
Ventilator
other
also.
things have been also increased.
Yes. Okay.
So we were able to find immediately that there is a black.
Yeah, so you diagnosed it fast, but you could not manage it.
Material is on it. Yeah.
Yeah.
So,
So,
yeah,
okay.
when the
So again, don't go in ICU with a biased mind. Okay, never go to the ICU in a biased mind, because then you are likely to get carried away. Okay. You
So-
could have changed the oximeter if I would have given you the oximeter. I just purposely took some time
So
to give you
whenever
oximeter.
she
Then I
went
asked you,
outside
how
and
is the
came with an
database, sir?
oxygenator, then it came out in mind it cannot be an oxygenator change because it would have been prepared beforehand.
We thought of blender, but not the part of filter.
Yeah, so that
We
is
saying
important.
blender is an issue. We have increased the sweep gas.
So that is why we.
So the right thing he has done is, he has taken,
cylinder.
so to rule out blender issue, how will you diagnose? Take it on oxygen cylinder. That is what he has done. In spite of taking on oxygen cylinder, still things doesn't improve. So it means you have changed the blender. Now what is remaining changing is
that's
the tubing.
Tubings. Yes.
Tube, change the tube. Even if that would have been a, say, a false attempt or may not be a successful attempt, that would not have cost you anything.
Yes, sir.
Neither that is going to cost to the patient anything, that
Yes.
tube is not going to be hardly be costing anything. Okay, and you are not going to waste that much time for diagnosing. That could have been immediately diagnosed, and we could have immediately came to the diagnosis. Okay.
The thing is,
Fine.
when there is discoloration and we are sure of oxygenation failure, the time you gave to calm our minds, that made him diagnose that part, I feel. So when there is, we are not able to find the source of cause, so we should take time. And then
Go
we
back,
will
think,
take-
and decide. See, you were getting carried away in the flow. So don't get carried away in the flow. Just when you are stuck, go back, revise,
Have we done everything?
then, yeah,
or
then
is
do it.
anything missing?
and probably that is going to help you not only in ECMO but in even ICU practice also, isn't it? No, color change won't come.
Color.
Color change won't come. Okay, fine.
Okay.
So well done.
Thank you.
Thank you, sir.
Thank you, sir.
So next time, tomorrow when you come, I want that it's a teamwork and coordinated work. Not only a teamwork, isn't it?
Okay.
Thank you.
Thank you, sir.